Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friend. Welcome to this week's episode of the Healing Pain Podcast. On today's episode, we're talking about stress and burnout in the student physical therapist. Over the last 10 years, the prevalence of psychological distress, depression, and even anxiety related to the lived experience of just being a college student has absolutely skyrocketed. COVID certainly has intensified it. Stress and burnout have been recognized in many health professions, but specifically researchers have reported that many DPT students or Doctor of Physical Therapy students are actively experiencing moderate to high levels of stress each and every day. Academic burnout, which is a form of psychological distress, is also high in DPT students. Now, the consequences of unaddressed stress or academic burnout include things like decreased academic performance, reduced empathy, decreased professionalism, physical and mental health problems, even things like substance use and suicidal ideation. Now, burnout in physical therapy school doesn't necessarily stop there. Professionals can carry over this burnout into the professional phase of their career. Basically, DPT students are at risk of burning out even before they enter into the profession. And the sad thing about this is that it's really been associated with an intent to leave the profession, or what many of you might identify as turnover in physical therapists. In my opinion, I know many of you listening to this episode today believe this to be true as well. Academic burnout and professional burnout, really throughout the entire profession of physical therapy, is a top priority. We can't support people with chronic health and mental health problems if we ourselves are overly stressed and burned out. And really, we know this to be a profession-wide problem, which means that everyone from the Commission of Accreditation of Physical Therapy Education Programs to DPT program directors and faculty to everyday clinicians and employers should take steps to reduce or mitigate burnout in physical therapy professionals. Many of you know last year I conducted some research with Annette Wilgens and Kirsten Palambero, who are physical therapist professors in DPT programs. And we demonstrated that an ACT training for chronic pain significantly reduced burnout, secondary traumatic stress, and compassion fatigue in DPTs with 0 to 2 years of experience. You can read that article. It's called The ACT Trained Physical Therapist in the Journal of Contextual Behavioral Science, which is where it was published. However, I'm even more excited to bring you today's guest, Dr. Jason Cherry, who is a physical therapy professor and is working inside DPT education programs to research and develop ways we can help DPT students cope with stress and burnout. This includes identifying the relationship between psychological flexibility, stress, and academic burnout in DPT students. Jason is an assistant professor in the Division of Physical Therapy at Binghamton University. He is a board-certified orthopedic clinical specialist and has over 20 years of clinical experience in pain management, orthopedic, sports medicine, and the acute care setting. His area of research is related to the relationship between psychological flexibility and the management of perceived stress and academic burnout. On today's episode, we discuss the important relationship between stress, burnout, and psychological flexibility in the DPT student, and some of the research that Jason has already conducted on the importance of this topic for physical therapy students, educators, and the clinician. Okay, without further ado, let's begin and let's meet Dr. Jason Cherry and learn about the relationship between stress, burnout, and psychological flexibility in the DPT student. Hey there, Jason. It's great to have you here this week.
Thanks, Joe. Great to be here. I'm a big fan of your work and your podcast. So it's my pleasure.
Thank you. I'm excited to speak with you because I know a lot of the things that you're working on builds on some of the work that myself and other colleagues have worked on. So it's great to see, I think, like minds kind of coming together and discussing these topics for DPT students and, of course, later on physical therapy clinicians and really the whole profession, right? Because we're all starting to look at burnout and stress and how it impacts, our personal health, our mental health, our physical health, our relationships. I mean, really everything. How did you become interested in burnout as a topic?
Well, as a physical therapist and healthcare practitioner, I've certainly experienced my share of feeling like I was burnt out. And I've worked with colleagues who went through those types of feelings and sensations. And now that I'm in academia, I certainly notice it with students. And one thing I think that happens is professional burnout may actually start with student burnout or academic burnout. And so I'm particularly interested in solving the problem at the DPT level so that we can hopefully prevent it from occurring once our students go out into the profession.
Yeah, I love that. So getting kind of to the root of the problem, which really means that we may be starting to smolder a little bit in PT school, even before we get into our internships, our residencies, or fellowships, and of course on to, our career path and trajectory.
Right. I mean, there's basically people write about two different ways to look at the burnout problem. And one is to address the environment, and second is to address the individuals. Mm. And, I think the answer is and, it's not or. We certainly can do some things to improve the academic environment. But my concern is that these students are going to go from the stressful academic environment to a potentially even more stressful professional environment. So if our job as PT educators is to prepare our students for careers in physical therapy, I think we definitely need to prepare them to be able to cope with what they're going to be experiencing as professionals.
Well said. I'm sure if there are DPT students listening to this, that really resonates with them. And of course, it resonates with maybe even new physical therapists who are just graduating and realizing, I had to deal with the stress of school and the boards. And now, some of that stress is carrying over into my professional life. How do you define stress and academic burnout? Because I know there are kind of maybe two distinct things that we need to kind of just piece apart for people.
Yeah. So in the study that I performed, we defined stress as perceived stress. So which, perceived stress is the way that somebody appraises a stressful or difficult situation, because a stressful situation means different things to different people. Mm-hmm. And so you can kind of measure that based on the individual's response. And then, so you have perceived stress, and then the thought is that as perceived stress increases, it eventually leads to academic burnout. And that the way that progresses is it starts with perceived stress, and the more stressed people are, the more they're having to cope, the more they're using their resources to cope with that stress, they start to get exhausted. And so that's one piece of the definition of burnout, is exhaustion. Then as they become exhausted, they need some way of dealing with that exhaustion. So sometimes they start to become cynical. In the academic environment, they start to question what they're learning, question the importance of what they're learning. And that then can progress into lower academic efficacy. So because they're questioning what they're learning, they don't perform as well. And so then they start to question their ability. And so that's important to mention. The true definition of burnout, according to Maslow, is the combination of exhaustion and definitely cynicism. There's some debate lately about the efficacy piece, that some people say that the efficacy piece isn't quite as important. So you definitely need the exhaustion piece and the cynicism piece. And then for the full definition, also the efficacy.
I like that. I can really see the kind of downward spiral almost as you're talking, right? Because, right. We're all going to experience some type of burnout, but if we can intervene, and as you said before, help people cope before it moves on to that emotional exhaustion, and then looking at that efficacy piece, I think it's really important. Now, I know you've started to kind of go much deeper into this and look at the construct of psychological flexibility, which mostly is kind of from the ACT world, although it's a common construct in many mindfulness-based approaches. It's something that I, as you know, am very interested in and have done some research in there. How did you become interested in that particular construct? And I think, having talked about this for years, it's always just helpful for people to kind of redefine what psychological flexibility is and maybe why that's important in the context of burnout.
Yeah. Yeah. So I came across psychological flexibility through my own experience. As a human, especially as a healthcare provider, I've come up against difficult situations, and I've tended to have more what we would call negative coping strategies, right? So I would tend to try to avoid those difficult situations, or try to change the situation, or distract myself by drinking beer or eating ice cream or binge watching Netflix shows, um, which would help in the short term, but ultimately didn't do me very much good in the long term. And then a while back, I had a particularly stressful situation occur, and I went to those strategies, didn't work. I sought psychological counseling, and I had a high deductible and couldn't afford it, which is, sort of says something for our current healthcare system.
Mhm.
Number one, I couldn't afford it, and number two, I couldn't find a provider that could see me in a relatively quick period of time. And then I came across a book, and I can't remember how I found the book, but it's called The Happiness Trap, by Russ Harris. And I think the more you talk to people who are exposed to ACT and psychological flexibility, the more you hear that book come up as sort of the entry point. And I think the title is what grabbed me. Was I was trying to be happy, and I just couldn't find a way to be happy. And the book is based on acceptance commitment therapy, and psychological flexibility. And what I learned from the book was that I was actually trying too hard to be happy, and that I needed to go in a different direction. And so that sort of brings us to the definition of psychological flexibility. And first, we have to understand that pursuing a meaningful life is going to be difficult. There's going to be challenges and tribulations. And so that's sort of the first part of psychological flexibility, is being open to experiencing difficult situations, difficult thoughts, difficult feelings. And then to notice when we are getting derailed by those thoughts and feelings, and then shift our focus to the present moment and our behavior so that it's in alignment with our values. So number one, you have to know what your values are in order to pursue them. And then I think the hardest part is the noticing. So you have to be able to notice when you are getting distracted by your thoughts and your emotions, and then sort of pivot that focus towards the present moment, because you might be worrying about the past, or worrying about the future. But the psychological flexibility involves being able to pivot that focus more on the present moment and in alignment with the values.
Mm. The idea that a doctoral trained licensed health professional can't access counseling, mental health services when needed, I think really, it just says so much about our country, our society. The other thing that I started to think about too, and thanks for sharing with us. I think it's really important, but I think patients actually expect that we have these skills somewhat kind of, instilled in us from school. And sometimes we do. Sometimes we have them from previous life circumstances. And sometimes the things that we face as professionals or even just people extend beyond our skills, even beyond our doctoral skills. And I have friends who are mental health professionals who see counselors on a regular basis, and they've gone to school for 8 years to be clinical psychologists, and they're still supporting their own mental well-being. So I appreciate you bringing that to the physical therapy profession, because I think it's definitely a conversation we need to have more in the open about how are we training PTs with regard to cognitive and psychologically based skills, and really, taking a moment to notice, okay, how are you as an individual right now in academia? How are you doing? How are you as an individual right now in clinical practice? How are you feeling working in that environment? How is it impacting your health, basically? I'm not really sure. And, I know this is the work that you do. How are we starting to open the eyes of, early PTs in school to the idea that you actually might have to not only track your patient's health, but you actually might have to track your own health as you're going through your career?
Yeah, I think, it starts with letting the students know that it's normal,
Mm.
that stress is normal, that difficult situations are normal, that we all feel these ways sometimes. And I tell my stories to my students. There are times after a lecture when I wonder if I might have shared a little too much, but I think it's important to share that so that, because imposter syndrome is real, and they feel like they're not supposed to feel stressed. They're supposed to be confident, right? And
Mm.
they look up to us as professors. And so when they hear that we go through similar feelings, similar thoughts, I think number one, it helps them realize that what they're going through is normal. And then I hope that that also bleeds into them wanting to help patients with these things as well, because then they realize that, yes, it is a normal part of the healing process as well, that they need to address.
Yeah, I mean, of course, as professionals, we really gravitate to the idea of like this physical resilience.
Right.
However, we also have to start to recognize there is a mental, psychological resilience that is kind of bi-directional and kind of working off each other. So it's great to hear that. All right, so tell us about your study. I mean, I know you went through an ED program, and this was a lot of your work, and you spent a lot of time and probably years researching. So tell us about your study and tell us what you found.
Yeah, so the title of my study was The Relationship Between Psychological Flexibility, Perceived Stress, and Academic Burnout in DPT Students. And the reason why I conducted the study was because I ultimately want to teach psychological flexibility or acceptance commitment therapy skills, so that students can work on their own psychological flexibility. But before I did that, I wanted to see, is psychological flexibility relevant in the DPT population? I had a pretty good idea that it was, because it's relevant in so many other populations. But I thought a good first step was to see to what degree does psychological flexibility correlate with perceived stress and academic burnout.
So, did you look at a certain population of students over the course of a certain amount of time, and how did you measure that?
So we looked at students from 4 different campuses just after midterms, because we wanted it to be a time that was relatively stressful, but we didn't want to do it at the end of the semester when they probably wouldn't fill out our surveys. So we used questionnaires. We used the compact questionnaire to measure psychological flexibility. We used the perceived stress scale, which is the most commonly used scale for perceived stress. And then we used the Maslow burnout inventory to measure academic burnout.
Mm. And did all 3 of those, did you find significance in all 3 of those, or?
Yeah, so what we found was that psychological flexibility was a predictor of lower perceived stress. So that's sort of what you would expect. It was an inverse correlation. And not only that, through linear regression, it not only correlated, but it also predicted perceived stress.
Mm.
And this was kind of cool because it aligned with the theory. So also psychological flexibility was a predictor of burnout, academic burnout. But then when you look at the different dimensions, we looked at the three broad components of psychological flexibility. As you know, there's 6 processes that can be organized into 3 basic components. So you have openness to experience, which is the ability to be present in difficult situations. You have behavioral awareness, which is also the ability to be present and to be aware of how you're behaving in a specific situation. And then you have valued action, which is the ability to move towards your values. And so openness to experience was the biggest predictor out of those 3 areas, was the biggest predictor of perceived stress. It was also the biggest predictor of exhaustion, which sort of makes sense from a theoretical perspective. We think that the higher the perceived stress, then that translates into higher exhaustion. Then with the other 2 components of burnout, different parts of psychological flexibility influenced each part of burnout. So it was the behavioral awareness component of psychological flexibility that was the biggest predictor of cynicism. And it was the valued action component that was the biggest predictor of academic efficacy.
Interesting.
Yeah. So that was, sort of what that means to us is that, number one, interventions to help students learn the skills to become more psychologically flexible can help with stress and burnout, and that maybe different parts of psychological flexibility can be emphasized depending on what's going on with the students. So, actually measuring the students as a group, what degree of perceived stress are they under? How much exhaustion are they experiencing? If those are looking high, you can perform intervention as a group. That's, you don't want to separate out the different components of psychological flexibility, but you can emphasize certain components. So with those types of groups, you may get better results if you emphasize the openness to experience component of psychological flexibility.
It's nice to see those three pillars map onto what you did, right?
Yeah, it was comforting to see that my results matched up with the theory, for sure.
Yeah. So let's talk about the openness pillar, the openness to experience, which
Sure.
if you're looking at just like a traditional ACT model, that's diffusion. And, diffusion's really a big part of it there.
Right.
Acceptance is the other part of it.
Right.
Just through your lens, as you're looking at that pillar with the diffusion, the acceptance part, and you're saying, oh, this pillar needs to be trained in physical therapy students. What is that kind of, if you take me back a little bit, maybe like into your study, did you start to think to yourself, physical therapy students are really because the opposite of acceptance is avoidance and the opposite of diffusion is fusion.
Right.
They're really fused with their thoughts and they're really avoiding things that are uncomfortable or unpleasant, which could be physical sensations in their body.
Yeah.
It could be the yearnings and cravings that we all experience as humans.
Yeah.
There's so many facets to that. So I'm wondering if you kind of, I know obviously when you do research, you're looking for, the statistical significance piece of it, but just kind of through your own perspective, like how do you start to see that show up in the lived experience of a student?
Yeah, I think that's a good way to look at it, is from the student's perspective. And this sort of goes to the idea that you cannot separate out the different components. You may be able to emphasize, but it goes back to values, I think, and really having conversations with students about what their values are and what their ultimate goal is going through physical therapy school. And that's, I have the benefit of teaching the first class in the program, and so I can talk to students about this a little bit. And so on day one, we talk about what is it you want to become eventually, because physical therapy school can be a bit of a drag, right? And people go into it thinking, I just want to get through physical therapy school, right? And we all do that. It's that hedonistic treadmill of, I just want to pass this exam. I just want to pass my practical. I just want to get through this semester. I just want to get through physical therapy school. And I think with that mindset, there's a lost opportunity, because we can start developing expertise during physical therapy school. So on day one, we talk about what that means. What does expertise mean to you? And the question is, what type of physical therapist do you want to be? How will you be as a physical therapist? How will you interact with patients? How will you interact with your colleagues? And so number one, getting those values open out front first. Then I think bringing up, what might you experience as you pursue those values? What sort of difficulties might you experience? What sort of thoughts might you have? What sort of doubts might you have? And even bringing that back to previous experience, because they've all overcome things to get to physical therapy school. And they've had to experience difficult situations. They've had to experience difficult thoughts. They've had to experience difficult feelings. And so I think framing it from that perspective, what sort of thoughts might you have? What sort of things might you try to avoid that you really shouldn't, because if you do avoid them, you're moving away from your goal versus towards your goal. I think that's a big part of it. And then the other part, I think, is just talking about thoughts with students, because we have this tendency to sort of believe our thoughts and let our thoughts sort of push us around and dictate what we do, and that's part of the cognitive fusion. But we don't necessarily have to do that. And so we do some exercises that are kind of fun to help students realize that thoughts aren't necessarily true or false. They're just the story that your mind is telling you, and it's up to you whether you follow that story or not. And ultimately, what can help you decide is this story, is this thought helping me move towards the person I want to be in the classroom, or is it helping me move towards the person I want to be in the clinic?
So two things come up for me here. The first is kind of more of a research perspective. Was there any qualitative data that you collected on just their experience?
No, I wish. I think that's a next step is to.
Yeah.
And not only that, this is just a correlational study, so we can't say that this is causative, right? We can't say that low psychological flexibility causes stress or burnout or vice versa.
Right.
So the next step is to do more experimental studies, to do interventions with the students, to see if it does improve their stress and academic burnout. And that, I think, is also a good place to do the qualitative piece, as to how did they feel as they were going through it? Was it helpful? What do they think about this idea of not necessarily following your thoughts and feelings?
Yeah. In our study, we had that qualitative piece. Annette Wilkins, who's a physical therapy professor, and she teaches now at Nova Southeastern, I believe the Tampa campus, and she's an excellent qualitative researcher. And some of the qualitative reports that come back from, what showed up in our study was that psychological flexibility really is an essential skill for physical therapists to manage the types of conditions that we see. So it's interesting to look at people's experiences and hear, in their own words, how it impacted them and their health. So the second thing, and this is for people, if people have, they've studied ACT, they've taken my courses, they know that a big part of becoming ACT informed is that you, the professional, right? So let's say I'm a physical therapist and I become trained in ACT for pain, that it's not so much that I'm doing something or providing an intervention, but it's actually that I'm modeling psychological flexibility in myself for the patient.
Yeah.
So as I'm listening to you talking about, we need to help students, reflect on where they're going in life and what they want to be and how they want to, act and be in life. Do physical therapy educators need to model psychological flexibility for the students? And what are your thoughts around that? Because there's a bit of vulnerability wrapped up in that, because a part of psychological flexibility at times is saying, I'm struggling with this one thing right now. And here it is. Here's what I'm thinking. Here's what I'm feeling. Here are the images that are passing through my mind, et cetera, et cetera. And I'm not really sure. I can't think of an experience like that happened in physical therapy school where the professors were modeling it on the level that you and I are discussing here.
Yeah, I think that's an important question. And I think every professor has to decide that on their own. My personal feeling is that I think we do need to model these things and be a bit more explicit about our thought process, even in the classroom, because the good professors that I know change as the semester goes on as far as how they deliver the material based on what they're experiencing. I think the more we verbalize that, that we don't, we noticed, that's the big thing, is noticing, right? We noticed that something didn't go very well. Or so, for instance, I've had classes where the previous class didn't go well, and I wasn't happy with it. And so the next class, I've mentioned that to students. I've said, I didn't feel very good about the last class because this, and this happened. And that's not in alignment with how I want this class to go and how I want to be as a professor. So here's what I think we need to change going forward. And when I've done that, I've gotten positive feedback from students. And when I share some silly things with students. And like I said before, Joe, sometimes after class, I I wonder if I should have shared those things because it's uncomfortable. But I value sharing those things so that students can learn from me, from my experiences and from the mistakes I've made. So if I'm going to be psychologically flexible, I need to be willing to experience that discomfort of putting myself out there in service of my value of helping students realize that these things are normal and that they can build these skills.
What's the risk when students don't have these skills?
The risk can be drastic. The risk can lead to severe clinical diagnoses. There's even suicidal ideation does occur amongst physical therapy students, and we have literature that documents that. So the risk and the consequences are high for the students themselves and also for their future patients and the healthcare system. We know that academic burnout can lead to professional burnout, and that professional burnout leads to errors and increased cost of care. And it's a big drain on our healthcare system.
Yeah, I think it's important to bring all that up. And we didn't really talk about it in the beginning, but sometimes there's a perception that, oh, you're burnt out. You need a week off, right? You're burnt out. Take a week off, go on vacation, de-stress, kick back, have a beer, as you say, a glass of wine, nice meal, go to the gym. Right. And when people don't have these skills, especially professionals, really, we're talking about these are pathways to, as you mentioned, clinical depression, extreme amounts of anxiety. Secondary traumatic stress really is aligned with post-traumatic stress disorder, which, we're seeing now post-COVID in many different health professionals. And I think, the one that doesn't come up a lot, which we need to talk about more often, I think, is in many ways, this can be an intent to leave the profession.
Yeah.
So we train excellent therapists, right? Go through school, sit for the boards, they last a year, 18 months, and then they're like, I need to transition to something else because they can't obviously tolerate or manage their burnout. So I think those, obviously the mental and the physical health also, people don't, connect that. Burnout is a physical health problem as well. Like your physical health will change when you are burnt out.
Yeah, I think that's, we sort of talked about this earlier. You cannot separate the mind from the body as much as we would like to. And we have these discussions with students where we talk about psychosocial aspects, and they get a little bit scared when we start talking about the psychological components because they think that's outside their scope of practice, and they get worried about that. But as I tell them all the time, you cannot separate the mind and the body. They feed on each other. The body feeds on the mind, and the mind feeds on the body. You cannot treat one without the other.
That's right. And in any licensed health professional space, it's very difficult to treat one without the other. Yeah. So you've been, obviously this is your EdD work. I know you presented a couple months ago at the Academy of Education and Leadership, I believe. Yeah. So people are starting to become aware of your work. How would you like to see your work adopted maybe in other, let's say, schools or throughout the profession to serve and help physical therapy students?
Yeah, so I think this study has shown that psychological flexibility is correlated with stress and burnout. And I think one of the reasons why I gravitate towards acceptance and commitment training, as we call it when it's non-clinical, and psychological flexibility is it's a tool set. And so I think we know that resilience is an issue and mindset is an issue, but we have good intentions, but what we tend to say is students need to be more resilient. You need to be more resilient. You need to have a growth mindset. When students hear that, they just hear that there's more wrong with them. That they don't know what to do with that or how to fix it. And the reason why I really like psychological flexibility is it gives the tools to help students become more resilient and to help students develop a growth mindset. And so that's why, if there was an impact, that's my biggest hope. And there's more research to do and more to show. But my hope is that physical therapy programs will start to integrate the education of these tools. And it doesn't have to be acceptance commitment training, but something to work on the cognitive behavioral aspects for students, to give them the tools to be more resilient.
Yeah, that's well said. When I was at the conference 2 years ago, and I sat in on a lecture where there was a woman, a physical therapy professor, presenting this model of, I can't remember what it was right now. It was like a model of how to help students learn better. At the very, very top of the model was metacognition, which is just the idea of being able to observe your own thinking. And that was at the top, but she spent a lot of time like on the bottom, explaining all the pieces on the bottom. And I said to her, what do you do to work on the top part there, metacognition, which is a mindfulness, psychological flexibility type approach? And she said, oh, we don't really do that. We don't work on that. And I'm like, well, you might want to, if you want that model to flow, right? That might be, as you mentioned, that should be, instead of telling students, you need to be more flexible, you need to have a growth mindset, be more open-minded, is a very different conversation than, as part of our program, we nurture you in how to be more behaviorally flexible, psychologically flexible, mindful as a clinician, and which we know spills over into life, right? So it impacts us on a personal level.
Definitely.
Yeah. Jason, it's been great speaking with you. I know a lot of people are going to want to learn more about your work and follow things that you're doing in the academic environment and DPT programs. How can they follow you and learn more about you?
Yeah, so I am at Binghamton University. If you want to get in touch with me, the best way is email. And my email is jcherry, CHERRY, at binghamton.edu. I'm not a big social media guy because for me, it can lead to avoidance of what I really need to be doing. So the best way for me is through email.
Great. So you can, of course, email Jason. His email, if you don't want to rewind on your phone there or what you're watching, you can just go to the show notes at the Integrative Pain Science Institute and you can find his email there. I am big on social media, so I'm there a lot. I love Instagram. If you're on Instagram, tag me and say, hey, this is a great episode. Jason's work is great. And it's great that you guys are talking on this level about really mental health in physical therapy, right? That's what we're really talking about in some way, how to improve the mental well-being of the profession of physical therapy and other professionals as well who are looking at similar challenges right now. I'm Dr. Joe Tatta. It's been a pleasure being here with you this week, and we'll see you next week.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.